So, hello and a very warm-hearted welcome, everybody. I'm Fran Rose Bullock, cancer survivor and founder of the Cancer Fitness Expert. And you are listening to the Thrive After Cancer pop-up podcast, where I'm joined by experts in recovery to bring you a wellness toolkit to support you in your cancer recovery journey. So, in today's episode, I'm joined by the lovely Tanya Buxton, owner of Paradise Tattoo Studio in Gloucestershire, where you specialize in medical tattoos. Welcome, Tanya.
Hi, thank you for having me.
Oh, it's fabulous. And so I'm thrilled to have you here. It's amazing. And it's a really fascinating subject. I think a lot of people have got a lot of questions and it's definitely a growing area. I think more and more people are going down this road, whether they've had reconstruction or not. And yeah, I think everyone will be excited to hear what you've got to say today. Can you start off by telling us a little bit about your journey and what inspired you to specialize in mastectomy, areola or nipple tattoos, and medical tattoos in general?
So it's a bit of a weird story to be honest. So I started out as a tattoo artist um about 15 years ago now. It's like 2009 I started. I've always wanted to be a tattoo artist for as long as I can remember. So it's always been my first love. And I've always worked with sort of scars. I've done sort of scar cover-ups, mastectomy tattoos and things like that throughout my career, sort of from the beginning of my career, really. So I've always
Okay.
been really aware and mindful of like the healing layers and stuff that, that tattooing can offer people. And in I think it was 2015, I branched out into cosmetic tattooing, which is what they call permanent makeup. So sort of eyebrow tattooing, eyeliner, lips, things like that. Which was always something I wanted to do. I sort of love makeup and things, so it kind of went hand in hand that I could tattoo that onto people's faces. And I think just sort of doing that type of tattooing opened me up to a whole other world of clientele that might not necessarily have walked into a tattoo studio, may not even wanted sort of like a decorative body art tattoo, but were looking for, more of the beauty treatment sort of tattoo side of things.
Mm,
I think just sort of being a tattoo artist as well, people had that little bit more trust in me to do more specialized things. So just by pure accident, really, more specialized cases were coming through, sort of people that had like lost their eyelashes or their eyebrows through like alopecia or chemotherapy treatment, were wanting them sort of tattooed back on. Scars, burns where maybe the brows and stuff had, or the lips had been affected. And it
mm,
just kind of opened me up into this almost like restorative type of tattooing, really.
mm,
And that was how the nipple tattooing came on my radar. It's sort of, I've always kind of known about it, like known it was like a thing, but I'd never really given it any thought. And obviously, as a tattoo artist, I didn't really know why I hadn't given it any thought because it made perfect sense that we were doing things like that. But that was sort of it, just I was seeing it more and more. It was,
mm,
and unfortunately seeing stuff that had not been done very realistically or of a high quality, and it just sort of lit a bit of a fire in me, to be honest. And I started offering clinics, sort of nipple tattoo clinics for people in my studio. It was just a little single room paradise at that point. It was just little old me in a room on my own.
mm.
And I just started doing the clinics for free for the breast cancer and BRCA community, just as a way of giving back. I think when you have that type of skill, it's good to put good energy back out there. So it was always something I wanted to do for the community. And
Mm.
it just exploded, if I'm honest. And I wasn't prepared for it or expecting it. Um, and it's just been crazy ever since. That was about 5 years ago. It's
Wow.
absolutely bonkers ever since. I think it's a really needed service. So
Yeah.
here I am,
Wow.
exploring the world of nipples
You get many compliments on your nipples.
all the time. I think my favorite is when I meet someone and they're like, "Oh my God, I love your nipples," and then like, "Your tattoos. I mean, your nipple tattoos."
Just to clarify.
Yeah, yeah. Never thought I'd be an expert in nipples, but here we are.
Yeah. Well, someone's got to be. No, I think it's fantastic. And I love, yeah, I mean, it seems like you've given so much back to this community already, and it's just so wonderful. And I know you've set up as well a charity. Um, so yeah, do you want to talk a little bit about that as well?
Yeah, so it's just been a wild ride these past few years. So I started offering these clinics, um, sort of free of charge out of, for me, I'm just giving my time, and a bit of equipment sort of thing. But
Mm,
what that gives somebody else, I can afford to give my time to somebody who needs that. And that was always how I viewed it. So I used to do sort of one a month, or as and when it was needed, but it was just growing so much, like the demand was huge. And
mm,
I think being a tattoo artist and having that artistic ability as well as the tattoo ability, that kind of realism hasn't been seen as much. And I think that maybe that's why it kind of caught a lot of people's eye, and just got really busy. But
mm,
it was the free tattoos that I was doing were getting so busy that it was affecting my income. So that was kind of how the charity was born. I just thought, if us as artists were still getting paid,
yeah.
our equipment and our time was being covered, then it wouldn't matter how many clinics I could offer, and I could offer them, and more people could then have the tattoos done. And so that was the idea behind the Mastectomy Tattooing Alliance, which is
Mhm,
a charity I founded in 2021.
mhm.
Or 20, I think it was 2021. Oh, it's just been so mad. We're a registered charity now, which I'm super proud of.
Wow.
Um, we've got several artists on the directory in the UK. We also have an artist in America that's on our directory as well, with obviously plans to expand. The whole idea behind the charity was to sort of create a bit of a trusted source of information and education for people. It can be a minefield trying to figure out where to start with something like this, and also like who to go to,
Mm,
who's experienced in it, who kind of knows what they're doing. So that was the idea behind the Mastectomy Tattooing Alliance, is we'd kind of build this, directory of artists that have been kind of vetted. We know people have been trained well, we know they're experienced and they're doing things safely and
yeah.
things like that. But we can also then provide funding towards the tattoos for those that need it, just
Mm,
to make things more accessible, make things more widely available for people, and
yeah.
raise more awareness. I think the tattoos are so empowering,
Yeah.
and they're so important for people. And I'm just really like passionate about getting it out there because they do make a world of difference to people.
Hmm.
It's incredible. It's so special to be a
Yeah.
part of. I love it.
Oh, I love that. Yeah, it's fabulous. And you should be so proud.
Oh,
Um, I mean, I think I want to just mention as well, because maybe you're too modest, Tanya. So Tanya's the first ever tattoo artist to be employed by the National Health Service and several other private health care providers in the UK, which is huge. I mean, just like that's just groundbreaking. I mean, I don't know if that exists in any other country. Maybe,
I'm not sure actually. No,
no. I'd love
it's
to know because, but that just goes to show the importance that people are starting to put on this, in terms of, it's really can be for many people like such a key in their recovery. It can be such a milestone in terms of confidence, like body image. Um, and we were talking about this the other day, like how there's that element of yes, it's a procedure that can be a little bit painful at times, but it's that having that choice, like making that choice to do it yourself, is so empowering. Um,
control again, isn't it? And it's something
yeah,
for you as well. It's on your terms,
absolutely.
your choice, like you say. Yeah.
Yeah, and giving you almost some closure, maybe on a chapter. I think a lot of people can find that. But
Definitely.
speaking from personal experience, I've just
Well, it's
sorry.
like a new beginning as well. Like,
Yeah.
yeah, new tattoo, new you.
Yeah, Totally. It is. It's you version 2.0, you know,
Yeah.
or 10.0 maybe.
And I think,
Um,
for me as the tattoo artist, I love being a part of that moment as
I
well.
bet.
Like
I
I
bet.
said to you the other day when we were talking, just seeing that person's face in the mirror when they look at their tattoo, whether it's a mastectomy, decorative tattoo, or a new nipple tattoo, or a little combo of the both. Um, just seeing them for the first time, you can't put it into words. Like
Mm,
it radiates out of someone that confidence. People stand differently,
mm,
like they love themselves again and they
mm.
feel like complete again. And
Yeah.
just think, oh
Yeah.
God, me and my little tattoo machine did that.
Oh.
Like I just love it. I really do. It never ever gets old. Like
Yeah.
every day is just
Yeah.
amazing to work
Yeah.
with. And I think now working with the NHS and other private hospitals, like working in their facilities, it adds like another layer to it as well. Like, there can be stigmas around tattooing and what tattooing is and what tattoo studios are like. And,
Hmm.
things have changed, things have evolved, things are more sophisticated. There are a big group of artists out there that, that we're professionals, like we know
Yeah.
what we're on about and
Yeah.
we're dedicated to this craft and
Hmm.
make it as safe and as high a quality as possible. And
Yeah.
I'm really proud that I'm kind of having those conversations within the medical field now, and it's kind of being recognized that it is an important part of someone's treatment plan as well, and
Hmm.
that tattooing's being recognized as something. And I think it's a really exciting time, and
It
yeah,
is.
I can't quite believe that I work in the hospital
It
time. It's been such a whirlwind.
I
I
can
forget
imagine.
really that, yeah,
I
it's
can
actually quite
imagine.
a big thing that's happening.
Yeah.
Um,
And
yeah.
maybe in 5 years it'll just be the norm, you know, everywhere you go. When you finish your treatment, right, we'll put you in touch with your tattoo artist, you know.
I
Maybe,
hope so. I do
yeah.
really hope. Yeah.
Yeah. Well, it's a bit for me, I mean, okay, it's not the same as having a reconstruction, but it perhaps is for some people. It's that choice, straight first of all, have a construct reconstruction or not, have a tattoo or not. And it's whatever we feel we need to give us that confidence. And I mean, I had a a tattoo done on my mastectomy, my foob, and only a couple of months ago. And I have to say, I'm totally convinced. It's really changed totally my body image. I will now wear things that I very nearly threw in the bin, or not the bin, gave to charity because um, I really thought I'd never wear them again. You know, things that were a bit more slightly revealing, but now I feel proud and I feel like I want to show,
Yeah.
show it off. And it's almost a shame that it's so covered up. You know, you can't see it right now. I won't get it out right now, but
It's,
but yeah, yeah, Tanya's seen it. So I can totally confirm how powerful it's been for me in my journey. Um, and another thing as well that we touched upon the other day was the fact that you do eyebrows and eyeliner, because I know I had my eyebrows tattooed just before chemo. It was a bit of a rush, which I think it is for many people. Um, but that again was something I found to be very, very important and was very happy to have done that.
yeah.
So yeah, do you find a lot of people come in and have and ask for that and get that done with you?
We do, yeah. And again, I think sometimes it's not something that people are aware of. Because there's obviously so much to think about, isn't there? Like, um, and again, I think there can be that bit of a stigma, like, oh, am I going to have these big black slugs on my face? And but like brow tattooing can look really natural and really soft, and if
Yeah.
it's done by the right person and the right artist, and I think like you say, it's just one less thing to worry about. And a lot of ladies that I do see, it can either be before they start their treatment, so they have something, before any hair loss, or it
Hmm.
could also be years down the line because sometimes the hair follicle just doesn't always recover, especially
No.
on brows. I think the hair grows back where we don't want it.
Yeah, always.
always. So I think it
Yes.
can be used at any point during your journey as well.
Yeah.
But I think it's sort of it makes such a difference to your face, doesn't it, as well? Like it frames all your features, and
Mm.
if that that little thing that can just still make you feel like you during all that treatment and stuff, then you know,
Why not? Yeah. Yeah.
yeah,
Yeah, because we
yeah,
were saying the other day, I mean,
you want
it's
to
one
feel.
thing losing your hair, which is completely devastating, and we're obviously trying to figure out scarves and hats and various different or wigs and various different things to deal with that. But eyebrows, it's very difficult to cover that up if we've lost our eyebrows. It's more obvious. Um, and
Yeah.
so I think for me, yeah, just having, like you say, one less thing to think about, one less thing to be conscious of and or embarrassed about, to a degree. And I think, yeah, it made a big difference. And I
I think a
mean,
lot of my clients do sort of say they, like you say, there are the nice scarves and wigs and on all that side of things, but like not having your brows
mm,
makes you ill
yeah,
and you know what you're going through, and not
yeah,
everybody wants everyone to know what they're going through, if you know what I mean. So I think it's a way of, again, it's claiming something back, isn't it? That bit of
yeah,
control, like I might be losing all my hair, but I'm taking control. I'm gonna have my eyebrows sort of thing.
yeah,
And I think that's where tattooing is so wonderful. Like it can be fun and expressive and creative, or it can actually be very needed and a very crucial part of how someone feels about themselves as well. Like there's just all these layers
yes.
to tattooing that I just absolutely love, and love
Mm,
being able to do that for somebody as well. And I think if you can make somebody feel better about themselves for
yeah.
whatever reason, then that's it's not work, is it? It's an incredible gift to be able to give. I just love it.
Yes. Oh, that's so fabulous. I love that. Oh, so I have a couple of sort of quicker fire questions, if you like, just because I think these are the sort of questions that a lot of people have around. I know I sure did before getting mine done. And I did think long and hard about mine. And I did my research and went to somebody reputable who'd already got experience, that was really important for me. Um, so we'll start with, so how long should somebody be waiting after surgery or perhaps radiation as well? How long does somebody really need to be waiting before getting a tattoo?
For me personally, there might be a variety of answers,
Hmm.
but for me personally, and in my experience, I say 12 months.
Hmm.
I think the sort of your mastectomies and reconstructions, they're major surgeries and they're deep incisions. So that scar tissue might kind of seem healed at the top, if you like, but there's so many layers going on underneath. And if that
Hmm.
scar tissue hasn't sort of fully remodeled and matured, sort of thing, and we then are breaking the skin again to tattoo it, even though it's only very superficially, that skin, it's almost like it's not ready. Like I always think of like cement, like if it hadn't set, like it's not ready to be painted on top of, sort of
Yeah.
thing.
Yeah.
It could lead to sort of extra trauma or scar tissue to the skin, or the pigment's less likely to take,
Hmm.
if you like. um so I sort of say 12 months after surgery. I
Okay.
also recommend 12 months after radiotherapy and chemotherapy. Like obviously the radiation therapy can really damage the skin. It makes it very sensitive. It makes it really thin.
Mm.
So again, it's a respect for the skin, making sure you're not causing any further damage, but also that we're getting the best results possible. So your skin needs to be as healthy as possible, kind of thing.
Hmm.
Um, and chemotherapy for me as well, it absolutely eradicates the immune system, as everybody knows. And as much as tattooing's in a clean, sterile environment, and measures are taken to make sure everything's fine, you've still broken that skin. So there's always a risk of infection, particularly if you're going to heal slower. So if
Mhm.
your immune system is down because of something like chemotherapy, you're likely to take that little bit longer to heal. So there's basically a bigger window for
Mhm.
something to potentially happen.
Yep.
Um, again, it is a very small risk, but for me, it's a risk not worth taking
Mhm.
because if you did run into any kind of healing complications for whatever reason, you've compromised the tattoo, which is, the good bit at the end. But it could be more difficult to kind of recover from, if an infection did happen or whatever, or
Mhm.
it could be that it escalates quicker purely because your immune system is so low, like you're asking your body to do something else on top of what else it's already
Yep.
gone through, sort of thing. So I just
Mhm.
think it's really important to give your body time to
Yep.
sort of fully recover. But I also think from like an emotional point of view as well, like so much has happened and it's usually, you know, you kind of told things, aren't you? And it's a bit of a whirlwind and you don't really know what's going on and it's a lot to process. And I think as wonderful as the tattooing is, and it's so positive and uplifting, it isn't going to replace what was there before
No.
and it won't make you feel like you did before. So
Mhm.
I think there's that kind of emotional healing that kind of needs to take place before you're ready to embark on that and do something different to your body, like, decorate it with a tattoo kind of thing. That's
Yeah.
my opinion.
Yep. No, I totally agree. Minimizing the risks. I mean, of course. And also, I think you're right. It's, if you're getting a tattoo done to try and replace something that was there before, um, it could be disappointing. Whereas if you're getting a tattoo done to enhance or make something in your, feel more, make yourself feel more beautiful, that's something different. And I think that's when it can be extremely, extremely empowering. And taking that time as well, okay, maybe you're going to do a nipple tattoo, but if you're going to do something more decorative, I know for me, it took me a long time to know what I want, what style.
Endless, aren't they now? Like,
It's
yeah,
it's
the art.
endless, and I think you should take time over it and enjoy that process. Enjoy the process of, imagining what you want to have done, imagining the design, coming up with a design, working with the tattoo artist as well.
Yeah.
That's so much fun, and that's all part of the positive side of it, and not almost not wanting to rush it too much and get
Yeah,
it
enjoy
done.
every minute. Like you said,
Yeah.
you're taking that control back, aren't you? And it is a process. And yeah, I think
Mm,
you're completely right. And enjoy that process and enjoy looking for designs that you like or enjoy searching Pinterest or
yeah.
Instagram or whatever you want to search for inspiration. Like
Mhm.
it's the fun bit, isn't it? It's the good
Yeah.
bit, the
Yeah.
kind of thing. Yeah. It can be difficult to navigate those conversations. Like for me, I've had to have those difficult conversations sometimes where maybe a person isn't emotionally ready and it is a permanent thing you do into your body. So I think it's important that you give yourself that time
Yeah.
to process and heal,
Hmm.
physically and emotionally sort of thing.
Absolutely. Yeah, 100%. Yeah. And on, you touched on it a little bit. Can we, yeah, what's your ability to tattoo over a scar? Is it a different procedure or is something different about it than tattooing on normalish skin?
Yes and no. So the techniques are all very similar. Most scar tissue you can tattoo over as long as it's kind of fully matured and,
Hmm.
had its time to, fully settle. So we're all different.
Hmm.
Everyone's circumstances are different. Everyone's skin health is different. So it isn't like definitely after 12 months that scar tissue is ready sort of thing. We all take our own time. So I do think it's important to see a tattoo artist who is like familiar with scar tissue, has tattooed over scar tissue before, because it is that little bit more specialized, like more care does need to be taken. And, sometimes you might need to change your approach a little bit depending on, how that skin is and, how the reconstruction is. There's just so many variables. So I think going to somebody who understands not just scar tissue, but breast reconstruction or no reconstruction
Hmm.
sort of breast cancer treatments as well, because all of that can play a factor in the tattooing process. It can influence the healing. So I think it is really important to go to someone
Yeah.
who's experienced in that, and don't be scared to ask an artist either. And, ask for examples of their work, or, go and meet that person as well. I think it's always nice to
Mm-hmm.
see where they work from, and you can get a feel and a vibe for the environment, and making sure you're comfortable and ask all your questions. Like the right artist won't mind spending that time and answering those questions for you as well.
Yeah.
But yeah, most scar tissue is tattooable, definitely. You just
Okay.
take your time and be patient, kind of thing.
Yeah. Yeah, absolutely. Um, and could you give us a couple of or some pre and aftercare tips? So if someone's thinking about getting a tattoo, what could they be doing, to make sure their skin is as healthy as possible and ready to have a tattoo?
Yeah, so I think if you booked in, and the countdown's on, kind of thing, making sure your skin is kind of as healthy as possible is always a real, good shout. The healthier the skin, the sort of the better the outcome, if you like. It's just a nicer canvas for us to work on, type thing. So
Yeah.
I think being hydrated, making sure you're drinking plenty of water so the skin's nice and hydrated is important.
Hmm.
Um, even like eating and stuff, making sure you're eating nice, healthy food, and um, you know, giving your body as much chance to be
Yep.
at its best, if you like.
Hmm.
Um, Sort of moisturizing the area regular again, so the skin's nice and hydrated. Will all make the tattoo process, um, I say easier, but
Yeah.
just make the whole thing.
Yeah.
You give it every chance to be as best as it can, kind of thing.
Yeah. Absolutely.
I definitely avoid sort of sun exposure a good few weeks beforehand, like especially to the area.
Hmm.
Obviously, like sun damaged skin isn't always, you can't always tattoo over it if you're really sunburnt. But if you've got like quite a heavy tan, if you've just been away on holiday, that skin's going to be a little bit damaged and a bit drier anyway, so it might not
Okay.
tattoo as well. So I'd say like a good 3 or 4 weeks. Try and not, be
Okay.
out in the sun if you can.
Yep.
Um, and sort of like tanning products as well. More so that if you're covered in fake tan and then you get your tattoo, you're just going to have this real white area once it's been wiped away repeatedly. But particularly with like the nipple tattooing, if you've got a fake tan or something, it can throw your eye off color
Mm,
matching as
right.
well,
Yeah.
because obviously
Hmm.
skin color is not what it is at most of the time, if you like.
Yeah.
Um, Sort of the days leading up to your appointment, or even day of appointment, just try and kind of limit caffeine and alcohol. Um, get a good night's sleep the night before, have a real good breakfast before you go, or like, a good meal
Mm,
at least sort of 2 hours before your appointment. Take some snacks,
yes.
um, any excuse really. Um, like
Yeah.
water, maybe a sugary drink,
Hmm.
just to sort of keep like your energy levels up more than
Yeah.
anything. So when you're getting tattooed, your body's a bit like, what's happening? So
Yes.
like your adrenaline's everywhere, and if you've not eaten, and that's like obviously your blood sugar levels can drop, and that's when you can feel a bit funny. Like it's not actually the tattoo in itself, or because it's so painful you're gonna faint kind of thing. It's if you've not eaten enough and you're not
Yeah.
rested, things
Yes.
like that.
Yeah.
And even just things like what you're gonna wear. Wear something loose and comfortable, maybe like a zip up hoodie or a shirt, so you can still kind of keep yourself covered, but there's access to the area, kind of thing. So if you get chilly, you've still got something on.
Yeah.
And then sort of after, your artist will go through the aftercare. It's a basic wound healing aftercare advice. Sort of keep it clean, keep it dry are
Yeah.
the main things, if you like. You do kind of need to avoid a couple of things. I'd avoid any real heavy exercise for those first few days of it healing. The healing cycle's relatively quick. It's usually anywhere between like 5 to 10 days approximately.
Hmm.
Again, we're all a little bit different, but it's not a super long amount of time.
Hmm.
Sort of avoid swimming,
Yeah.
You can have an everyday shower if you like, but you don't want to soak that tattoo for like a long amount of time. So yeah, like baths, swimming, hot tubs, saunas, all those sorts of things. Just avoid those. Once
Hmm.
it's healed, obviously you can do whatever you like, but
Yeah.
sort of don't prolong any kind of water exposure if you like.
Hmm.
But your artist will go through how they look after things. Everyone has their
Yeah.
own ways. But
Yeah.
yeah.
Their own different creams, perhaps that they recommend.
Yeah.
Um, One question that I asked when I went and had mine was whether I can use, because there's these like anti-pain sprays and creams, and I was told that it's really not a good idea because it can change the texture of the skin. Is that right? Is that
Absolutely.
yeah,
Yeah, I'm not a fan of them either, to be honest. So
yeah.
it almost like it can create a bit of a barrier on the skin. So
Mm,
it can actually be a little bit more difficult to tattoo. And it also makes it harder for us to read the skin
hmm.
sort of thing. So I
Okay.
think particularly on reconstruction and scar tissue, you really don't want to accidentally overwork an area because you can't feel properly what you're doing and you can't read that skin properly because something topical has been put on it that's
Yeah.
changed that barrier.
Yeah.
Um, but also I mean, it's especially here in the UK, you can't really buy things like that. Um,
Okay.
you either have to go on like an American website or it's not something we can't buy numbing creams and sprays here very
Okay.
likely available. So
Yeah.
there's always that risk that you may have bought something that isn't legit as well, and you don't always know what's
Mm,
in it. There's been sort of horror stories of things that have been bought off Amazon and they've got like a chemical burn from it. And so,
mm.
it's
Okay.
for me,
Best
it's
avoided.
not
Yeah.
worth. Yeah.
Yeah. Yeah.
Yeah.
Yeah. That's the message I got as well. So on that then, how much is it going to hurt? So I think a lot of people want to know,
Question.
and I know, I imagine it's a scale. For some people, they're going to breeze through it, and others not so much. But in general,
I mean, yeah, everyone's pain threshold is different. We all have good and bad days as well. Like I've been tattooed some days and I've sat there for hours, and then other times I've sat there for like 15 minutes and I'm like, no, I'm done. Um,
Mhm.
but I think in my experience with sort of mastectomy tattooing, 9 times out of 10, the sort of your nerve endings aren't 100%.
Mhm.
So any kind of pain that is there, it isn't that 100% nerve feeling, if you like. Particularly with like the nipple tattooing, it's quite a
Mhm.
small area. It doesn't overly take very long. It usually takes me about half an hour per nipple to actually tattoo it. So it's
Yeah.
not, you're not there for hours and hours on end. So it's very manageable. A lot of sort of people say they feel the pressure um, but not
Mm.
like the sharpness of the needle, if you like.
Yeah.
But there is that risk of hypersensitivity. I don't see it as much in my experience. I do find most people have less sensation.
Hmm.
But again, things can just be navigated. If you are hypersensitive or things are getting too uncomfortable, just have a shorter tattoo session and let it heal and come
Mm.
back and finish it another day, sort of thing. There's always ways around it. So I think don't ever let the worry of how much it hurts put you off having it done if that's what you want to have done, sort of thing. Because
Yeah.
there's always ways around it to make it manageable, definitely.
Yeah, yeah. And it sounds like with you guys, like people would be in really good hands and you're very compassionate. So you've got that understanding, which people, we want to, at the end of the day, when we have been prodded and poked and things with treatments, like you say, we don't necessarily want to have more pain, but when we're choosing to have a tattoo, yeah. And as long as we're aware of what's to come, I think that yeah, we can manage it. And
And that was always the idea behind Paradise. Like Paradise Tattoo Studio now, there's a whole team of us. It's a female team.
mm,
Not intentionally, it's just the way it's ended up being. But there's private rooms here. It is very warm and welcoming. It is sort of like a soft, safe space. People, it's pink and tropical. And people kind of walk in and they're like, oh, it's
oh.
not what I thought a tattoo studio would be like. Because I
Sounds
think, yeah,
lovely.
that experience and feeling comfortable and stuff, it makes the world a difference,
Oh
doesn't
yeah.
it? To how the tattoo goes. If you kind of sat somewhere, where a big open room with 10 other people getting tattooed and it's cold and you're not going to have a nice experience. Whereas if you're in a nice warm pink room,
Yes.
good
Yeah.
playlist, like yeah,
A nice cup
it's
of tea.
very important. Yeah. As well
Yeah.
as the tattoo, it was always important to me that people have a nice time and that they feel good.
Yeah.
Like you always remember how you feel, don't you? And it's such an important day for everyone.
Mm,
Coming to get these types of tattoos, it's a day you're always going to remember. So yeah, we always try and make it
yeah.
a special day for everyone.
Yeah. Yeah. It's so true. And it can be such a milestone. And like you say, you want to come away with that warm feeling of you've been looked after, you've been understood, um,
Yeah.
and you've come away with hopefully something that you've thought about having for a long time. And yeah, and just the whole
Yeah.
package, really. I love that. Um, so so one question I have is what would you like to see then going forwards? How would you like to see things develop in this area of well, what would we call it? Sort of medical tattoos, I suppose.
Yeah. Yeah, I think with the sort of medical tattooing side of things, I'm really kind of excited for the future,
Mm,
in the medical field as well. I think for me, I would love for it to be part of someone's treatment plan. So, when you're being advised what can be done and what to have, and you're also told about this bit you can have after as
mhm,
well. I think that, it could be a real sort of little light at the end of the tunnel for a lot of people when, you're hearing everything that you've got to go through, but at least you kind of know, okay, like we'll go through all this and then at the end I can have this done and feel a little bit more like myself again. And I think that's, it's working within the NHS and private hospitals now. It's a real big thing of mine. Like I want to build those relationships and, sort of showcase what can be done with the proper skills and knowledge. And also, making sure like the training and education out there is
mm,
how it should be as well. It's something that I offer training myself now. I spent years developing a training program for tattoo artists to be able to learn this skill, but I'm also working really closely with the medical side of things to support them as well, because, there are nurses out there and, consultants and surgeons that do offer the nipple tattooing. And I think a lot of the training and education that's been accessible to them hasn't been as like thorough as it could be.
yeah,
And there's no ongoing support. These things are always changing and evolving as we learn. So
yeah,
that's a real big key thing for me as well, is to sort of be there to offer that ongoing support and sort of training and
yeah,
mentoring as well, and to just improve the service
yeah,
as a whole,
yeah,
because the better the tattooing is, it's the patient's going to benefit from it. And I think it's an important service. Then patients deserve the best, and
mhm, yeah,
that's just a real big thing of mine now, that it's done as well as it can be done, sort of thing.
yeah. I love that. Yeah, I think just like you say, raising the standard and therefore raising that level of confidence that patients and clients can have in the system and know that the people doing this are knowledgeable, understanding, have their technique is second to none. So is that yeah, yeah, they're
you know
just
as much as it's amazing and empowering, and it's so nice to be a part of, and how amazing it makes people feel. I've also seen the other side of it. So when that tattoo's not been done well,
mm,
or it's not very realistic, or it's not the right color, or it's not been tattooed very well, and it's actually created scar tissue on that person.
mm,
Um, and it's devastating for people, and I feel like it's actually worse to have something
mm,
not good on there than nothing at all.
mm-hmm.
And there's all sorts of different kind of safety aspects and risks with it not being done properly.
Yeah,
So it's a real big area for me that I think, tattooing being embraced a little bit more by the medical side of things now. I think it's a really exciting time because we
Yeah.
can both learn from each other,
Hmm.
and it's only going to improve the nipple tattooing itself kind of thing. So I'm
Yes.
excited for
Yeah.
what it brings, definitely.
Oh, I think it's fantastic. I think it's amazing, and I just, yeah, I'm really impressed by all of the work that you're doing and the awareness that you're raising. It's super, and I think it's going to impact, in a really positive way, so many lives. I really do. Um, and yeah, hopefully that just grows and grows. And
Yeah, I hope so too. Yeah.
yeah,
It's just so important, isn't it? Like, and I think it needs to be recognized. It's not something cosmetic. It's a very needed part of someone's journey as
yeah,
well. And it's not just about how they look at themselves physically. It's about how they feel about themselves as well. And I think it doesn't just impact the person that's had it done, it impacts the people around them.
hmm,
The amount of partners that have messaged me and are like, you've totally changed my partner, like,
yeah,
I've got my wife back, or,
mm,
even, like mums that didn't want to get undressed in front of their kids because they didn't have nipples and they didn't want their young kids to think that that's what they look like.
wow,
So having to lock the door every time you go in the shower, or and just not having to worry about that now, or going taking your kids swimming or going to the gym or the spa, and not thinking you want to cover yourself in front of people because people aren't going to look in the nicest possible way. People aren't going to look,
yeah,
and I think that's what a lot of people want. They just want to feel normal. I don't like that word, but
yeah,
it is a word a lot of people use.
yeah, yeah,
And giving people the confidence to do things that they didn't want to do before, like what you said, like wearing clothes that you didn't think you'd ever wear again. I had a lady, she's had a double mastectomy with no reconstruction, and we're doing this sort of real beautiful peacock feather. It's this big huge tattoo.
wow,
It's amazing.
wow.
She's incredible. And she recently went on holiday, and she's always worn a one piece because she felt like she couldn't wear like her bikinis. But she was saying, now I've got my tattoo, I've bought myself a new bikini.
Wow.
And like the amount of women that have never got undressed in front of their husbands and now they will.
Yeah.
Um, so there's all that, that intimacy side of things with your partner,
Yes.
and I just think it has this huge ripple effect. Just this little teeny tiny tattoo or a big tattoo, what you have done.
It's true. That's what I mean. The impact of, something relatively small and relatively quick to do. The impact can be, like you say, the ripples into relationships, intimacy, confidence, and that can spill over into every element of your life. Um,
I,
and yeah, it's so beautiful. Yeah.
I do love it, or so I could talk forever about. I think that that's a real big thing of mine. I want the
Yeah.
medical field in particular to
Hmm.
really recognize that it is an important part of the journey. It is an important part of the treatment plan.
Yes.
It's not just this cosmetic thing that some people might get. It's a real huge significance
Yeah.
sort of thing. So that's a real big thing of mine as well.
Yeah. Well, I know for one that my oncologist will be definitely listening to this episode because he requested it. um, which I think is fantastic. I mean, that just shows, doesn't it? The level of interest and the sort of questions that they're getting asked. And of course, he doesn't really know. He would like to know more. But he very much said it would be great to have somewhere that he can, signpost people to find out more information and this sort of reliable source. So, yeah, shout out to Dr. Bodmer.
Hello.
Um, so on that note, where can our listeners find you? If they want to find out more, they want to ask you a question, they want to come to your studio, the pink jungle, pink
Paradise.
paradise. Yeah, how can they get hold of you, Tanya?
So you can find me personally on Instagram. It's
Hmm.
just my full name, so it's Tanya Buxton. And also my website, it's just tanyabuxton.com.
Mhm.
And there's details of where you can find me, all my other hospital locations, as well as being at Paradise. And then my tattoo studio, Paradise Tattoo Studio, is based in Cheltenham in
Mhm.
Gloucestershire, so in the sort of southwest of the UK.
Yeah.
And you can find us on Instagram as well. It's the paradise_Cheltenham, or just paradisetattoostudios.com on the website. And then, of course, there's the charity as well, which is full of useful information. There's a directory of artists there that I sort of have vetted and trust to do the tattoos. And obviously, also, there's funding available there for those that need it. And that's Mastectomy Tattooing Alliance on Instagram. And then mastectomytattooingalliance.org is our website as well.
Super. Super, super. Well, I'll put all of those in the show notes so as that, just in case nobody noted, it was able to note them all
A
down.
mouthful.
I will make sure they are there so that everybody can find you. And yeah, thank you so much, Tanya. It's been enlightening and yeah, lovely. Lovely to speak
Oh,
to
thank
you.
you so much.
Thank you. And thank you as well to our listeners. Please feel free to share this podcast with friends, loved ones, anyone that you think can benefit. And join me, Fran Rose Bullock, very soon for the next episode of Thrive After Cancer. See you soon.